starting. Thanks a lot. So let me introduce to you our speakers today. Nurgul Musaeva is Associated Professor at Bishkek State University, and today she is going to speak about the topic the development of social work in the penitentiary system in Kyrgyzstan. And this is, of course, not only a topic for a talk, it also is one of the key pillars of the SOLID project. And this is why we are very proud that Nurgul managed to conduct a research project together with Aysulu, Shailubek and other members of Bishkek State University, and together with the prison system of the Kyrgyz Republic. The results of the project were the publication of a guidebook in Russian language, which is now used for social work trainings in the penitentiary system. And Nurgul will tell us more about this work and also what is now being done with the results of this research project. Because this is not only a model for Kyrgyzstan, it is also transferred to other countries of the region. Kazakhstan, for example, is also interested in developing social work services in the penitentiary system and will have a close look at the work Kyrgyzstan has already done. So our program for today is that first we will hear Nurgul's presentation, and then we will hear a comment by Heino Stöver. And I also would like to introduce Heino Stöver to you, because to some of us he's new, but for most of us, of course, he doesn't need any introduction. But Heino Stöver is a professor, a senior professor at Frankfurt University of Applied Sciences. He's a social scientist by training and has published extensively about social work and especially prison reform and prison conditions. And he will give the comments to Nurgul's talk. And then after that, we will have a Q&A session with all of you. So please take notes of the talk, and you can ask all questions that you have. Now I'm going to share the screen. So please let me know if you can see it. Is it okay like this?
We can see it, but not in the presentation mode.
Mm-hmm. Yeah, so, okay, then let me check whether I can do this. Here we are again. Yes, can you see it?
Perfect. Yeah, it's
okay,
perfect.
Great. So we are Sandogash is coming. Very nice. So Nurgul, the floor is yours. You can start.
Nurgul, you are muted.
And now?
Yes, perfect.
Okay. Okay. Good evening, dear colleagues, dear our PhD students, dear Ingo, Heino. Thank you very much for joining the Solid Talks today. It's a great pleasure for me to be here and share our experience from Kyrgyzstan. I hope that our experience will be helpful for you also. Today, I will speak about the development of social work services in penitentiary system in Kyrgyzstan. This presentation is based on the cooperation between our university and the prison service of the Kyrgyz Republic. We started our cooperation 2 years ago, and since that time we are working together, and we worked on developing practical guide for the preparation of social workers for the guide for social workers for the penitentiary system. I am also very honored that Professor Heino Stöver will join today as a discussant and share his valuable experience and knowledge on prison reform in Central Asia. Okay. First slide. This slide presents that the transformation of the penitentiary system in Kyrgyz Republic. In recent years, important changes have taken place in the country. The system is gradually moving from a mainly punitive approach to a more rehabilitation-oriented and socially focused model. Today, more attention is given to the protection of prisoners' rights, human dignity, and social support. Psychological and social assistance are especially important because they help prisoners with resocialization and successful reintegration into society after release. And the penitentiary system of Kyrgyzstan is also gradually moving toward international standards, including humane treatment of prisoners and the development of social work services in correctional institutions. Social work with prisoners is based on the legal framework of Kyrgyz Republic, including the constitution, the criminal code, the penal enforcement code, and the concept for the development of the penal system. In addition, the state program for development of the penitentiary and probation system for 2024 and 2028 has been approved. And next slide, please. Here, you can see how you can. This slide can help you understand the scale of the penitentiary system and the conditions in which social work with prisoners is carried out. It concludes correctional institutions, pre-trial detention centers, institutions for different categories of prisoners, and structures responsible for supervision and support. The number and the location of these institutions are very important for organizing social, psychological, and educational work. A wider geographical distribution creates additional challenges related to staffing, professional training, and common standards of support and equal access to social services in different regions of the country. In this slide, you can see that the head of the unit who also works as a social worker in the penitentiary system is a multifunctional specialist. This person supports prisoners throughout their sentence and plays an important role in their daily life. The social worker is responsible for organization and discipline in the unit, documentation, and daily activities. At the same time, this specialist also performs important social work functions, like conducting individual conservations, studying the needs and the personal situation of prisoners, protecting their rights, and helping solve social problems. And an especially important part of the work is the preparation for release. The social worker helps prisoners with documents, future housing, employment, education, opportunities, and communication with probation services and local authorities. And in many ways, the success of resocialization and the reduction of repeat offending depend on the quality of their works. And next slide, please. Here you can see that in the Penitentiary Service of Kyrgyz Republic, there is even a special concept of ideal head of unit or ideal social worker, and the professional competitions are organized among staff members. This shows how important this position is within the penitentiary system. The ideal head is not only an administrative officer, but also a specialist who combines the functions of different services. Much depends on this person, including how successfully a prisoner can return to normal life and reintegrate into society. This work requires flexibility and individual approach. Different prisoners need different styles of communication, sometimes stricter, sometimes more supportive. For example, first, this social workers' professional qualities require first communicative skills, the ability to understand people, to prevent conflicts, to motivate prisoners and maintain discipline. Second, there are analytical and intellectual skills because the specialist works with a large amount of information and must make decisions in different situations. Organizational skills are also very essential due to multitasking and daily responsibilities inside the institutions. And also appearance and professional behavior are also considered very important. Staff members wear official uniforms and follow strict professional and ethical standards, which help maintain respect and trust towards the penitentiary system. Here you can see photo of psychological rehabilitation room for penitentiary staff, because this part is also very important aspect of their work. You know that we provide in September research about professional burnout social workers in penitentiary system and shared with our results with the administrative of penitentiary service. And on January 16, 2026, yes, since New Year, a psychological relief room was opened in institution number 1 of the penitentiary service. Work in the penitentiary system is connected with high emotional stress, so creating such a space is very important. I think that this kind of rooms will open in other institutions also. The main goal of this room are to prevent professional burnout, reduce stress, and to create conditions for psychological recovery and better communication within the staff team. And next slide, main function of social workers is educational work also. Its main goal is the rehabilitation of prisoners, the development of respect for society and laws, and the improvement of the educational and cultural level. This work carried out with consideration of each prisoner's individual characteristics and includes support for newly arrived prisoners, educational activities, and social guidance within prison units. And next, please. Can you change, please, Ulla?
Next slide, please, Ulla.
Yeah, wait a moment.
The picture now you are in the prison, Ulla.
Something new. Maybe internet is not good.
No, internet is fine. It's just wait a moment.
We should learn about system, something
Yeah.
new.
I'm sorry.
Okay. I also cannot share. System says that only organizers can share.
So. Is it here? This?
Next, please. Could you change? Okay. Okay. This slide presents the main principle of social work within prisoners and its legal basis in Kyrgyzstan. Social work with prisoners focuses on identifying social problems and providing individual support. Special attention is given to vulnerable groups, including elderly people, persons with disabilities. Special attention is given to disabilities, prisoners without family support, and those who need special assistance. And an important part of this work is restoring social ties with family and society, as well as helping prisoners prepare for life after release through cooperation with NGOs and probation systems and other bodies. And next, please. And as in general social work practice, a case management approach can also be seen in penitentiary system. Work with prisoners is organized according to the individual needs, problems, and the personal situation of each person. This slide focuses on the assessment of prisoners' personalities, planning of educational work, and the main directions of rehabilitation activities. Specialists study social and demographic information, criminal history, and psychological characteristics, including education, family situation, health, behavior, personal values, strengths, and risk, and other questions. And based on this assessment, individual educational and social support plans are developed. Each social worker has a plan for 1 year or for half a year. The main areas of rehabilitation work include moral, legal, labor, psychological, and social support, as well as preparation for release. The final goal is social rehabilitation and successful reintegration into society after release. Next, please. And a strong emphasis in the penitentiary system is planned on the rehabilitation and the resocialization prisoners. Previous slide, please, Ola. Most activities and the programs are focusing on helping individuals, successful return to society. Even the department responsible for this work is called the Department of Social Rehabilitation and Educational Work. And since this year, they joined also psychological support. And now, I don't know how this department calls, Department of Social Rehabilitation, Educational and Psychological Work. And this slide presents the main directions of social rehabilitation for prisoners. A comprehensive approach is used, covering 6 important areas, including legal, medical, psychological, social, and professional support. And the rehabilitation program focuses on 3 key goals: restoring documents and legal rights, supporting employment and professional adaptation, and most importantly, for preventing repeat offending, maintaining and restoring family relationships. Could you change this slide? Here you can see something from our culture. The slide presents cultural and educational activities as a main part of the rehabilitation work with prisoners. All prisoners have the right to participate in cultural and educational programs aimed at professional development. These activities help people gain confidence, develop new skills, and use their time in a positive way. And the main goal of this work is rehabilitation through socially positive activities. And these programs are important not for only entertainment, but for also helping individuals change their behavior and prepare for life in society. And as I know, such activities help reduce aggression and conflict, improve communication and social skills, promote positive values, and support successful reintegration after release. Change, please, slide. Okay, it is about social and legal work which provided by social workers. And this work aimed to protecting prisoners' rights and helping solve important social and legal issues. Social worker helps prisoners obtain or restore important documents such as passports, ID numbers, certificates, birth certificates, and other official papers. Support is also provided with pensions, social benefits, and other services, especially for elderly people and persons with disabilities. In addition, the specialist provides legal information and cooperates with state institutions and social services. And the main goal of this work is protect prisoners' rights and support their successful reintegration into society after release. And it can also be noted that starting from the new year, prisoners allowed to undergo medical examinations in prisons. Previously, they don't have this possibility. As a result, prisoners can now obtain disability status and receive social benefits. Also, at the same time, this kind of work is very, difficult area of the practice, because it requires a lot of bureaucracy, interagency cooperation, and time. And in many cases, the final result depends not on the social worker, but also on the work of different state institutions and administrative procedures. Next slide, please. and educational work in quarantine unit is also very main part of social workers. The quarantine period, because it's the first stage of prisoners' adaptation to life in the correctional institution. And during the first days, specialists conduct social, mostly psychological assessment to better understand the person's background, needs, and possible problems. And an important role is played by the social worker acting, yes, and through individual conversations and analysis of personal lives. They study the prisoner's personality, social situation, and behavior. And the main goal of the stage is to help the person to adapt, yes, to the institution, explain their rights and responsibilities, and to create the basis for further rehabilitation and social support. And next slide, please. This slide is about social work with women, especially pregnant and breastfeeding women. This kind of woman also can be sentenced to imprisonment if the court decides so, but the law provides them with special, more humane conditions of detention. According to the Penal Enforcement Code of the Kyrgyz Republic, women prisoners have the right to maternity benefits, which are paid regardless of whether they work in the situation or not. In addition, pregnant women and nursing mothers are provided with improved living conditions and increased nutrition standards, ensuring additional state protection. Importantly, pregnant women, breastfeeding mothers, and women with infants are not placed in disciplinary isolation units or transferred to stricter conditions in order to protect the health of both mother and child. And according to the Article 17 of the Penal Enforcement Code of Kyrgyz Republic, improved living conditions and increased nutrition standards are also guaranteed for pregnant women and nursing mothers, children, as well as prisoners with disabilities of group first and second. And this topic of women prisoners is a separate area of study. It is also very interesting for us. We will also try to pay special attention to this aspect in our future research, I think. Next slide, please. And some words about penitentiary probation. According to the legislation, this work must begin 1 year before to the end of sentence, within 10 working days after identifying eligible prisoners. A set of measures is initiated. First, data is recorded and sent to probation service for registration. Then, second, efforts are made to provide prisoners with paid work work so they can have financial support after release. And third, an individual plan is developed through interviews to identify social, medical, and family needs, as well as to restore contacts with relatives. And special attention is given to social protection issues, for example, informing guardianship authorities if prisoners have minor children without care. Overall, penitentiary probation is based on close coordination between the correctional institution and the external social structures. And next slide, please, Sola.
Yeah, the next slide is there.
Yes, and in recent years, the legal framework of penitentiary system, social work as system, whole system in Kyrgyzstan has been significantly updated. Many key documents were adopted or revised between 2024-23, including the state budget program, development of justice system for 2023-26, approved by presidential decree. These reforms clearly show a shift in focus from a purely punitive approach toward resocialization. And overall, the legal framework of penitentiary system in Kyrgyzstan has become more modern, comprehensive, and development-oriented. And at this stage, we are studying. Okay, and also I wanted to share one information that we are studying topic in more depth. There is a clear interest in developing a comparative perspective to better understand how penitentiary systems and social work function in different countries. And we, together with Larissa, Feruz, Ayajan, and Asiel, we have submitted an abstract for an international research project titled Social Work and Psychological Support in Penitentiary System, a comparative study of Central Asia and Europe. And the study is carried out by a team of researchers from Kyrgyzstan, Germany, Kazakhstan, and Uzbekistan. And the main idea of the project is to compare how social work and psychological support are organized in penitentiary systems in Central Asia and Europe, and to identify similarities, differences, and best practices. And we think that this comparative approach helps us better understand ongoing reforms and supports further development of rehabilitation and resocialization practices in different contexts. Thank you very much for your attention. That's all from my side.
Yeah, thank you very much, Nurgul. That was really interesting. So, thanks a lot.
Thank you.
Now I think we can hand over to Heino, and we are curious to hear your comments and discussion points. The floor is yours.
Thank you very much, Ulla. Do I do it without camera? So I'm not able to, let's say, join. Oh, here we are. So many thanks, Nurgul. Good to see you, and Ayselu, and fantastic to hear about your recent project, the guidebook, and the study outline you just mentioned with members of the other countries. What you're doing is that you are emphasizing the need for social work in total institutions, in the prisons, and also forensic psychiatry, in all the closed settings, we would say, where social work is needed as a key prerequisite for a successful rehabilitation. And Kyrgyzstan, I remember myself, just based on several visits in several Kyrgyz prisons, Kyrgyzstan is more or less the front runner of the introduction of innovative methods and strategies in order to help prisoners not to re-incarcerate, not to repeat, not to come back into prison. And this is based definitely on the way social work is put into the focus of the incarceration of the sentence, including all the other points you mentioned, including the looking at the health status, looking at their family and social background, and many other things. So all in all, Nurgul and Aysalu, I think you hit the core of social work and the what shall I say, the potential of what can be done by the social work and also by psychological support in order to prevent prisoners to get back to the prison and stay outside in freedom without any falling back into criminal behavior. I think what you mentioned in your presentation is the tribal mandate, as we would call it, the tribal mandate of social work in the area of closed settings. The tribal mandate consists of 3 points. First of all, let's say looking for the needs of the prisoners, of the target group, and you outlined this perfectly. Second is the needs of the state, because the state is paying social work in order to fulfill certain tasks. And what you mentioned in the documentary way social work is operating, this is of major need and major interest. I remember the discussion about handing out passports to the prisoners, which is, of course, a prerequisite into normalization and into reintegration of society. It sounds banal, but in fact, in reality, it is a big issue in most of the countries of the SOLID project, because without any passport, many things are not possible. Not only, let's say, getting abroad, but also looking for work and other rehabilitation. And the third angle of the triangle, or the tribal mandate, as we would call it, is the professionalism of social work as a, let's say, as an area of its own, where social work has to focus on ethical baselines, ethical procedures, confidentiality, how to organize that, which is of course very difficult. I will come to that in a minute. In the prison setting, and many other things. So the tribal mandate, you outlined that with all your in the whole of your presentation, is something which is of great importance. And I'm very happy to see that you started the cooperation and you did a theory practice transfer from the university to the penitentiary service. And throughout my career, I've found it very important to undertake this theory practice transfer, because both sides are benefiting from that. The theory is benefiting from the detailed practice information people in the prisons do have on, let's say, incarceration, on what makes people, what is doing the incarceration with people, and many other things. So theory is benefiting. Universities, lecturer, students are benefiting from that. And on the other hand, the people on the ground of the penitentiary service are benefiting a lot of what is going on in other countries, what needs to be done in order to be successful in the rehabilitation way, and so on. And I think Kyrgyzstan is not only the front runner in introducing social work, and what we learned also in probation service. I remember Tinchtik Esteban, who was in his dissertation very far off, very far in, let's say, explaining how good probation services are looking. And he was one of the pioneers in that as well. But I see that Kyrgyzstan is not only, let's say, the front runner in that, but also the front runner in the reduction of prisoner per 100,000 population. When we look at the developments of the last 20 years, Kyrgyzstan is decreasing the number from more than 300 per 100,000 down to, meanwhile, 120, which is more or less European standard. We do have countries which are lower, which incarcerate lower than that. Germany has some 70, Netherlands, the Scandinavian countries, of course, but there are other countries like UK and others who have more than 120. But anyway, 120 is the European average, and you drop down considerably. And this is the structural movement, let's say, which is benefiting also from outside areas. I remember coming back to the medical and health service of Kyrgyzstan, that Kyrgyzstan is the #1 in the Asian region who, let's say, implemented all the WHO recommendations on how to combat HIV, TB, and hepatitis C infections. There has been a substantial study from Lars Möller from the WHO regional office for Europe in Copenhagen, and Denmark. They studied the methadone treatment already 10 years ago, more or less 10 years ago. So indicating that methadone treatment has been implemented already very, very early. On top of that, needle exchange programs have been introduced. A lot of other points of the comprehensive package consisting of 15 evidence-based interventions have been introduced into Kyrgyz prisons. And that is, of course, of major importance and spreading out to other countries in the region. So coming to an end, a few remarks to this transformation process, which Kyrgyzstan is undergoing since more than 10, 15 years, with important changes in the rehabilitation and probation service. I think one of the most, how shall I say, the most difficult task you mentioned is the task or the function of the chief of detachment or the chief of department. Mm-hmm. He or she is in a dual function. On the one hand, head of the penitentiary service in a small unit, and on the second hand, at the same time, social worker, which of course is this double function of great importance and is tricky in the way because confidentiality, is hard to fulfill for these persons. Usually in many other European countries, social worker is working independently from the manager of the unit, of the department, or the detachment, as you call it. And that brings a little bit more, let's say, confidentiality to the prisoner or the social workers coming from outside, from NGOs, from the external services. Or a system we do have in Germany is that, especially for infectious diseases, social worker coming from a special NGO, which is called AIDS Service, AIDS Help, which is tackling the very tricky way of HIV, AIDS, TB, and hepatitis infections in prison, indicating that the whole health status of people is permanently under pressure not to fulfill the task of confidentiality. And of course, this leads to, let's say, not open up for the health status in all the details to the chief of detachment and so on. So many, I think this is an area we should discuss in the remaining minutes at least.
Yeah.
And we can go on with that, Nurgul and Aysolu, on a, let's say, on a bilateral way. Yeah. So this is, for the moment, my comment and my contribution. Many thanks, Nurgul. It was amazing what you have achieved in the last years. Thanks a lot.
Mm-hmm.
Thank you very much, Heino. And yeah, I think this was clearly showed that your research and also the practical thing that you're doing in Kyrgyzstan are interesting for a lot of other countries as well. And with this, I would like to open up our discussion to the audience. So everyone is invited to ask questions. You can ask a question directly. You can raise your hand. Or you could also write a question into the chat. And I see that there's one person, not surprisingly, who already raised his hand. And this is Ingo Ilya. So please go ahead. But you are muted. You need to unmute yourself.
Sorry. Thank you very much, of course, first of all, for the wonderful presentation of your work. I have some remarks or questions also to you. One is concerning, you mentioned that the social worker and the system is working on reducing the psychological problems and of the staff members, which is, I think, very important. On the other hand, what is the psychological situation of the prisoners? Because as far as I know, the prison sentences in Kyrgyz Republic and all Central Asian countries are very long, even for a small, things done against the law. They have to be more than 5 or 6 or 7 years in the prison system. So this is one of the biggest problems. Also, social workers and medical health services are facing. Second question concerning this so-called the system, the criminal system of this so-called thief-in-laws, the Vodivusakonia. That means that the criminal activities, and when we had been in the prison system in Kyrgyz Republic, we realized that not the ward is, or the deputy of the staff is the, how to say, the master of the problem of the system, but as criminal activities within the prison. So especially heroin in Germany, or the prison, the chiefs always say, no, we don't have addiction and heroin consumption in the prison. In prison in Kyrgyzstan, they say, yes, of course we have, and that's why we already try to reduce the problem. So we have the Atlantis system in Kyrgyz Republic, so a prison in the prison where addicted prisoners addicted to heroin or other opiates are treated. And maybe you can say something about this experience. And the other one already mentioned by Heino is the probation system. So this is very important. And as far as I know, the Kyrgyz Republic is the only country in the Central Asian countries with having this kinds of probation system. Maybe I think Kazakhstan will also going into this direction. But that would be very nice if you can tell us about this. And last question and remark is already mentioned by Heino concerning the health system in Kyrgyz Republic. It's the Ministry of Health, which is responsible for health in prison, whereas in Germany it's the justice system. And as far as and it's a recommendation by WHO, and you started to do this. In Germany we did not yet. But what is your experience? Is it still working? So the Ministry of Health is responsible for this. Thank you, and sorry for this many questions.
Thank you very much. Ingo, shall I start?
Yes, please.
Thank you very much for your interest to the situation in Kyrgyzstan. And first question about staff and prisoners, which conditions more relevant? Yeah, you asked if I understand right. Both conditions, staff and prisoners as well, and yes, they have a lot of psychological barriers between communication between staff and the prisoners, and they cannot easily be open and tell staff how to say detailed information, give detailed information, tell about their problems. This barrier is how to say is very rooted, and but social workers try to do something and work through their family members to get some informations. And social workers, when we had meetings with social workers, they told about it, and it is a how to say it is a stigma if prisoner will write some how to say заявление, как бы жалоба, complaint, yes, about their condition, and it can create some problems for them, for prisoners, and into their between their groups. He can face some challenges, and so they try to help them through their family members. And about psychological conditions of prisoners is also very relevant, and also we can learn about it. And they also can they open, they can answer for the questionnaires. We had this kind of experience, but it is more close than staff, and we need to have permission from the head of the system to ask some questions from prisoners. And about staff, as I mentioned, we provided research where we we identified that the psychological emotional burnout is in more than high level. It showed not very high level, but more than high level, up to the mid level, and so it said about that everything is not good in this stuff, and we shared our report, and we think that that's why they open this one psychological room for staff. And about second question, can I answer it? Second question, Ingo? Criminal system and criminal activities is also very interesting, and about addiction problem also very interesting. We wanted to learn about it, but we have some barriers how we can learn it. We don't know, and our social workers, they how to say we need to have contacts not only with social workers but with other staff also, and that's why this question is quite difficult for us. And third question about probation system. This probation system was clearly described in Stöber's dissertation, and they we have very close cooperation between probation system and penitentiary service, and they all time in contact with each other, and they inform each other what's going on and what kind of problems they have, how they can solve these problems, and like that. And this probation system is also quite new for Kyrgyzstan. It begins about 4 or maximum 5 years ago. And about health system, I haven't heard about this information. Maybe I missed this information, and we can check how is the health system in penitentiary system is now.
Okay.
Thank you very much, Ingo.
Thank you, Nurgul, for answering the question. There's another person who would like to ask the question, and this is Kasha. Please go ahead.
Nurgul, again, thank you very much for your presentation and for all the work. And I think whenever I hear about your collaboration with penitentiary system, I look at this with a great interest and also a little bit of enviness. And I had the pleasure to be there when you were launching this guidebook. So yeah, I have it. And I remember the atmosphere. So my impression was that the representatives of the penitentiary system, they were like eager to collaborate with you. So therefore, my question is, for this year and for the upcoming years, do you have any collaborative actions and activities planned? I also have it. So what exactly do you do together? Is this motion that was established, is the wheel running, right? So what do you do together?
Thank you very much. It was also a very nice question. We have a lot of plans. We and the system also, they are interested in cooperation. And first, you know that Asel Isaeva is doing her dissertation. It will be about professional burnout and personal changes. How staff can have some personal changes in their during their work, and what exactly we are doing now. We want to how to say, educate their social workers. They need some trainings about psychological, how to say, to do contact, how to communicate with their families, with their children, and also we need how to say, in this system I have one problem like текучесть кадров, how it can be translated. Staff changes a lot. Social workers change a lot, and yes, and we need to they need to hold this staff, and they need to how to say, explain the system, whole system in direct and simple words, what is the social work itself, and they need this kind of also trainings. And also we need to translate this book into Kyrgyz, because most of them are Kyrgyz boys who cannot speak in Russian well. So we have a lot of plans, and if we have some, how to say, plan, we can write them through our rector, and they we didn't have this experience that they said no. They said okay, and what can you do, and could you do this, could you, how to say, develop like guide or something else. And we are open to each other. Thank you.
Thank you.
Thank you, Kasha.
Thank you, Nurgul, for answering
also
this question.
I want to add some a few points. We agreed to have practice places for practice for our students, and 3 students had practice in the system, and one of them как трудоустроилась уже. She is also
employed, or
yes, employed, yes, employed as a social worker. And there must be 200 social work staff positions. There are, and now in the systems there are about they need about more than 20 social workers. Also, they need.
Okay.
Thank you, Kasia.
Thank you. There's another question from Heino.
Okay, thanks a lot. Not a question, just a remark. Thanks a lot, Nurgul, for answering these questions. And as far as I put some things into the chat on the transition of responsibility for healthcare and prison from Ministry of Interior or Justice to Ministry of Health. What we did, and this might be taken as a recommendation or so, what we did recently is we did a webinar for social worker working in prison. And this was a very outstanding thing I never did before. We've had more than 450 people in a webinar. So 500 was the close-up, and we've got 450 on new psychoactive substances in prison, which is a big issue here in Germany. That, let's say, paper is flooded with NPS, and it's a big issue in prison, actually. And this is something I would strongly recommend, as well as, let's say, to think about another fantastic book of your series, and NPS, social work in prison in general. We are just doing that with Larissa Steimle on social work in total institutions, coming out in a few weeks here in German. But this is also something I would strongly recommend.
I can add that psychologists who works with prisoners, psychologists and social workers, they now work together under one department, and most of psychologists are our graduates. They studied at Bishkek State University, and they are also open, and they also ask us how to collaborate and do something like was for social workers, something for their psychologists also.
Okay. Good.
They also need how to say systematize their instruments, approaches and methods, and this kind of things.
And what you stressed is that everything has to be done in easy language, because when we see the target group, which is badly needed, that we make ourselves understandable. Thanks a lot, Nurgul.
Nurgul, I also have a question. Maybe you can tell us something more about the practical side. So when you prepared the guidebook, it became apparent that there's a big need of social work trainings. So how do these trainings look like? Is it a day training? All the social workers of one institution are gathered in one place and they have a training there? Or is it a training of a longer period where people travel somewhere and have and follow a training course? So how does it work in reality, and who's actually the trainer? Are these social workers from the university, or is this other people working in the prison system? Thanks a lot.
Uwe, you, as I understand, you asked about the past, how we gathered information, or
no, how the training is working. So you mentioned that there's that social workers are working in the prison system,
Mhm.
but not all of them are professional social workers. So they need some additional training, I suppose. So how is the training conducted? Not the research, like the training for them.
This kind of trainings can be organized also in online format or offline format. Also, they can gather social workers when we prepared this guide. They gathered social workers, for example, who works with women, who works with children, who works with disabled people, yes, who is good at medical solution medical issues. They gathered as in the main campus of the service, and we provide our work. And about the training, we also can organize it depending on their circumstances and their needs. And we also think about it with ISOLU, how we can, how to say, get trainings, and we can organize it on Saturdays, because Saturdays they're busy or free, and they can go, how to say, come to our trainings. If I answered,
Yeah.
Ola?
Yeah, thanks a lot.
Thank you. Thank you, Ola.
Yeah. Are there more questions from our audience? Someone who would like to clarify something? So then I would think that we really had a very nice meeting today. Thanks for joining, and also thanks for bearing with us. This new platform is still new, so there are some things that we still need to figure out. But I think it worked very well for the first time. I would like to mention the next Solid Talk, but before that, I will switch off our the moment our recording. So the recording